and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Hada Gastro, and today's video is a super interesting one, so let's get started. So in today's video, we'll explore the question, what are 10 medical causes of rapid weight gain? So most of us will experience fluctuations in our weight, and it is common to gain or even lose weight over time. If you started taking in more calories than usual or cutting back a bit on your exercise, you wouldn't be surprised if the numbers on the scale crept up a little higher. But what if you're doing everything the same as you always do, and your weight still goes up? So while most of us have been conditioned to think that our weight gain is an indicator of our gluttonous and ravenous binging tendencies, when a person gains weight in a very short time for no clear reason, it could actually be a warning sign of an underlying health condition. So here are 10 medical causes behind your rapid weight gain. Number 1 is thyroid disease. So the hormones your thyroid gland releases help regulate your metabolism, meaning how efficiently your body burns food for energy. When your thyroid makes less of its hormones, as it does in cases of hypothyroidism, your metabolism slows down drastically. When this occurs, it means that you won't burn off calories as quickly as you usually did, and therefore causing you to gain weight. Another reason why patients with hypothyroidism suffer from weight gain is due to the excess accumulation of salt and water in their bodies. Number 2 is polycystic ovary syndrome. So PCOS makes it more difficult for the body to use the hormone insulin, which normally helps convert sugars and starches from the foods into energy. This condition is called insulin resistance and causes insulin and glucose to build up in the bloodstream. These high insulin levels in turn increase the production of male hormones called androgens, and high androgen levels lead to symptoms such as excess body hair growth, acne, irregular periods, and weight gain. So because the weight gain is triggered by these male hormones, it is typically in the abdominal region, where men tend to carry most of their weight. So instead of having a pear-shaped body, women with PCOS have more of an apple-shaped figure. Number 3 is congestive heart failure. So heart failure occurs when your heart muscles isn't pumping enough blood to the rest of your body. When the heart isn't pumping as efficiently as it should, fluids can start to build up in the body quickly. This can cause congestion in the lungs and other tissues, causing shortness of breath, swelling, fatigue, and weight gain. A sudden or steady gain in daily weight, for example around 2 to 3 pounds in 24 hours, or around 5 pounds over a couple of weeks, shows that the body is probably retaining fluid. And when this occurs, you might have swelling in your feet and ankles too. Number 4 is Cushing syndrome. So Cushing syndrome is a condition caused by having too much of a hormone called cortisol in your body. Progressive weight gain is the most common symptom of Cushing syndrome. The high levels of cortisol result in a redistribution of body fat, especially to the chest and to the stomach, and along the facial area, giving the patient a typical round moon face. A buffalo hump may also develop as the fat accumulates on the back of the neck and on the patient's shoulders. Number 5 is depression. So individuals who suffer from depression, anxiety, and other mental health disorders are more likely to gain weight because these mood disorders often result in higher levels of the stress hormone cortisol being released into the bloodstream, which usually causes fat to gather around your belly, similar to its effects in Cushing syndrome. And another reason why many mental health patients end up packing on the pounds is because they often feel too down to eat right or to get out and to do some exercise. Number 6 is insomnia. So ghrelin is the go hormone that tells you when to eat. When one is sleep deprived, more and more ghrelin is released into the bloodstream. Statistics show that individuals who get less than 6 hours of sleep per night tend to have more body fat, not only because of the hormone ghrelin, but because of the hormones cortisol and insulin too. A lack of sleep also causes your body to make too much of the hormones cortisol and insulin, which also leads to you adding on the pounds. Number 7 is kidney disease. So any untreated kidney disease will usually progress to complete kidney failure. Healthy kidneys remove the excess fluid from the body when we eat or drink liquids. But when our kidneys do not work well, they do not make enough urine to remove the extra fluid from the body, causing this fluid to pool up in various locations in the body, such as in the feet and the legs, and the body's cavities, such as the pleural or abdominal cavities, leading to rapid weight gain. Number 8 is liver disease. So a poor liver function can cause weight gain too, especially around the belly. When your liver cannot regulate fat metabolism efficiently, too many fats can build up in the liver cells, which can lead to fatty liver. When fatty liver occurs, it causes the liver function to deteriorate. Liver failure in turn causes ascites, a condition in which fluid collects in the spaces within your abdomen. And ascites doesn't just cause a swollen belly, but sudden weight gain too. Number 9 is diabetes. So people with type 2 diabetes have a condition called insulin resistance. This means that they're able to make insulin, but their bodies can't use it properly to move glucose into the cells, therefore causing the amount of glucose in their blood to rise. In an effort to keep the blood sugar within normal range, this in turn triggers more insulin to be secreted from the beta cells in the pancreas, which then goes on to cause weight gain, because when the body cells are prompted by this excess insulin to absorb more glucose, the body responds by converting all the extra glucose into fat. Number 10 is steroids as a treatment option. So steroid drugs are traditionally chronically used to treat chronic obstructive pulmonary disease, asthma, rheumatoid arthritis, and inflammatory bowel disease. Steroids alter the body's electrolyte and water balances as well as its metabolism, meaning the way it uses and stores lipids, amino acids, proteins, carbohydrates, and glucose. Weight gain in steroid use is typically attributed to fluid retention and an increased calorie intake because it also causes an increased appetite in these patients. Many people on steroids notice increased fat in their abdomen, face, and neck regions. And one little sneaky extra cause is menopause. So during menopause, many women will experience weight gain. The fluctuations in estrogen, progesterone, and other hormones often lead to an increased appetite and increased fat gain, especially around the woman's abdomen, hips, and thighs. Other contributing factors to a woman's weight gain during menopause include a lack of exercise and a slowly waning metabolic rate. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the 10 medical causes of rapid weight gain.